of training from the University of Minnesota, locally, and experience in academia and public health, she focuses on preventing heart disease and promoting overall well-being. Currently, she serves as medical director of health equity and health promotion at the Minneapolis Heart Institute. She actively contributes to a variety of committees and initiatives addressing cardiovascular health and serves on national advisory boards. Passionate about community health, she is an advocate for both local and national levels, on both the local and national level. Her mission is to empower individuals, families, and communities to achieve optimal health and well-being in body, mind, and spirit. And today she is here to tell us about the link between mental health and heart disease. Dr. Courtney, please, welcome.
Thank you. It's so great to be here. It sounds like the morning was amazing. I'm sorry to have missed that, but hopefully you guys will find this afternoon also interesting. Oh, and
There we go.
should we do it that way?
Either
Oh,
way.
now it works. All right. Fantastic. Thank you. All right. So you can see there a little bit about what we're going to talk about. We're going to talk about the connection between mental health and our heart. And then most importantly, because we can talk about facts and figures all day, hopefully you'll walk away with some strategies that you can personally use and you can talk to your friends and family as we all navigate our own personal journey to thrive, body, mind, and spirit. I don't have any financial disclosures. I'm just really passionate about this topic. So this is one of my favorite studies. It was a large study done in multiple countries. You can see it's called Inner Heart, and there were 52 countries worldwide, 262 centers that participated. And really the goal was to figure out if, from a cardiovascular perspective, if there were other things that we didn't understand that were causing heart disease. Were there things that we needed to further research? And you can see nearly every continent was also represented. And what we found was that, sure enough, psychosocial factors like depression, stress, anxiety, anger, and social isolation accounted for about 32% of your cardiovascular risk. So really, when we think about that, that's essentially about the same as tobacco use. It's about the same as abdominal obesity or weight in our middle. But yet this is something that when you go in and you see your doctor or your clinician and we talk about risk factors for heart disease, we don't often talk about your mental health. And then you can see any journal that you're going to pick up, you're going to hear about that we know, unfortunately, psychological disorders and personality characteristics also have this negative impact on our heart health. Depression prevalence is 3 times higher in our cardiac patients. And then we know cardiac patients also are at increased risk of experiencing emotional distress after an event, as well as impaired quality of life. I think the CDC has done a great job of depicting this in this slide here, because we don't really know if it's the chicken or egg. We don't know. As we've talked about, we know that anxiety, depression, chronic stress, folks that have lived through traumatic events and have post-traumatic stress disorder after, that promotes the development of stroke, heart failure, cardiovascular disease, metabolic disease, plaque. But then we also know that after people have these events, again, depression and anxiety is more common. So it's sort of this cycle that we really have to break up. And part of that has to do with the physiological process that actually happens during this, where when we're having emotional stress, we have increased inflammation, we have increased cardiac reactivity. When we think about things like C-reactive protein that we check, these things are all higher, as well as that sympathetic nervous system, that fight or flight response is high. So I love this because there's many days where I personally feel this way. But what we know about, and I know it's a really busy slide, but we know that 70 to 90% of all visits to healthcare are related to stress disorders. And if you could read that, you could go through and you could hear and see the, again, physiologic impact. So nothing that's just, quote, in our mind, but that stress has on our nervous system, that it has on our musculoskeletal system, that it has on our respiratory system, our cardiovascular system, right, which is the one we're talking about, our endocrine, as well as our gut or our GI system. So when we think about when people say, oh, do you have butterflies before you're going to speak at something, or you're nervous, there's actually things happening, right, that's changing our gut biome in that case. And these same types of things happen with the connection between our brains and our heart. I think it's important, as somebody who works in disparities, that we highlight some of the disparities that we see, particularly in women's mental health stats. So we know 1 in 5 women have a mental health challenge. Depression's 2 times more common in women. Women are 2 times as likely to experience post-traumatic stress disorder, 2 times as likely to experience generalized anxiety. In terms of earning, we know that women who work full-time earn about 1/4 of that of their male counterparts, and 65% of caregivers are women, whether it's the generation below or the generation above. And again, I say this because despite the differences in our chromosomes, we are 99% the same. And so we cannot look at these statistics and then look at our heart outcomes, because we have disparities in who does well. From a cardiovascular perspective, women do worse than men, without looking at our social construct. So we've been talking a lot about this, but what does happen with stress? So this is also fun to me. William Harvey described this in 1628. So it's not new, right? This is old data, but it turns out it's the same. A mental disturbance provoking pain or excessive joy, hope, or anxiety extends to the heart, where it affects the temper and rate. And that is, in fact, what happens. So we experience stress. It increases that sympathetic nervous system, the fight or flight. It increases our blood pressure. It increases our heart rate. It increases your blood sugar, insulin, inflammation, and on and on. And, from a genetic perspective, or from an evolutionary perspective, at time, right, this was a good thing. If a tiger is chasing you, if you need to pull your hand off of a hot stove, you don't want to think through that. But now we have these chronic levels of stress and mental health challenges in our life, and we are living in that sympathetic nervous system all the time. As a practicing cardiologist, I see this all the time, and we see it in our kids, right? We have a lot this younger, earlier metabolic syndrome. A lot of people kind of look puffy these days, right? We have this layer when we're in this fight or flight response all the time, and that cortisol is going of our body trying to protect ourselves, and unfortunately leading to the various chronic diseases that we have. So like we talked about, changes in our heart rate, bad changes, right? The lower our heart can be, the better. Increased blood pressure leading to high hypertension, increased cholesterol levels, again, leading to plaque, increased triglyceride levels, again, leading to diabetes, and then ultimately fat deposition around our waist and metabolic syndrome. I think it's interesting because there's a syndrome called broken heart syndrome, or Takotsubo's, which is Japanese for an octopus in the heart, because that's what it actually looks like to us. But perhaps you guys have heard about the stress-induced cardiomyopathy. It's something that we see when people transiently experience very large amounts of those catecholamines or those hormones in stressful situations. Often happens after a death. It can, every once in a while, we'll see it when it's something really positive in someone's life, but usually it's bad. It can happen with illness. But people come into the emergency room, it looks like they're having a heart attack to us. Their EKG looks like that. We rush them off to the angiogram suite to see if there's blockages in their arteries, and their arteries look fine. And it turns out usually then, when there's more time to have a conversation, that there's been a very, very, very stressful event, and they've had this rush of catecholamines. Interestingly, happens more common to women, and it happens to people more commonly over age 50. But I just want to emphasize, again, this isn't something that we're just making up, that the brain is connected to the heart. And we shouldn't be surprised, right? We're all connected. We don't get cut off at the head, but this is something that's been around for a long time. I would be remiss not to mention what's happened after COVID-19. And this is an older slide, but it wasn't that long ago, but I think many of us were extremely stressed. And this was something that ABC News had done about how much lives were disrupted, how much stress people were experiencing, and how worried people were. And I think we're just now starting to talk about the impact of the social isolation as well that went with COVID. But we will be studying the impacts of COVID-19 for decades to come. But it's really important because it was such a stressful situation in so many different ways for people that we continue to see, unfortunately, suboptimal cardiovascular care related to it. So this is one of my favorite quotes, and we're going to kind of move into the ways to mitigate this. Peace, it does not mean to be in a place where there is no noise, trouble, or hard work. It means to be in the midst of all of those things and be calm in your heart. And, you know, like I mentioned, as a practicing cardiologist, as someone who has lived through the death of a child, this is not something I'm up on a podium just speaking about. This is something I have lived and continue to live every day of my own life. And it's something that I feel a lot of pride in speaking with patients about, because it's absolutely critical that we understand these connections and that we hardwire our own ability to manage stress. It doesn't mean, again, that you're going to quit your job or be independently wealthy, but it means figuring out how to navigate this. So learning how to relax, to control or let go of what you can't change, and ultimately creating time each day, some amount of time that you do something you enjoy, is really critical. And if you walk away with nothing else, know that it probably can't be, you know, Netflix, a glass of wine, and a bowl of popcorn. That's your joy, because it's unfortunately, while it's fun in moderation, it's a little bit isolating and not good from a cardiovascular perspective. So there's a lot of things that have been shown to have lots of impact on both our cardiovascular health and our mental health. One of those, and the one that's been most studied, is transcendental meditation, which is, you know, kind of the highest level of meditation. And you can see here it's been shown to reduce cardiovascular risk factors, morbidity, and mortality. It's been shown to improve insulin resistance, autonomic tone, and it's also been shown to reduce plaque that's been found in our carotid arteries. There was actually a trial back in 2005 that showed a 30% reduction in death in patients who were randomized to transcendental meditation compared to the controls. Now, if we put that in pill form, you know, that would be the Ozempic of the world, and we would all be, you know, riding home on that pony, because that's such a huge cardiovascular reduction in mortality. So really, really big impact. It's just something that a lot of people aren't taught and a lot of people don't do on a day-to-day basis. And we also saw an even bigger impact in our Black population in terms of reduction in mortality, heart attack, and stroke. I have on the bottom two of my favorite apps, Headspace and Calm. And what I like about them is, as somebody who loves the concept of meditation, it's hard for me to slow my brain down, and I constantly want to, you know, do a grocery list or whatever I have going on that day instead of having a calm mind. But Headspace and Calm are both apps that you can download on your phone. They've been shown with as little as 5 to 10 minutes a day of practice on there, and someone actually talks you through the meditation, which I think is really helpful. You can take it wherever you want, but to improve our neuroplasticity, again, they've shown that via cardiac or brain MRI that the brain actually changes. So very impressive. This is a study that was done at my old hospital by a cardiovascular surgeon, Dr. Kashetri. And they had patients do guided imagery. So just, and for those of you who don't know what that is, it's basically kind of taking you to a place that ideally you've been to before, and taking you out of a higher stress situation. So, you know, you could go to the beach of Hawaii and you're thinking about hearing the waves. You're thinking about tasting the salt in the air from the ocean. You're you're hearing birds, you're seeing the beach, you're all these different things, bringing in all of your senses, but it's actually a practice that you learn how to do. And again, this was done at Abbott Northwestern Hospital. And sure enough, it matters what you're thinking in your brain as you go into surgery, right? As you go into cardiovascular surgery. For most of us, you're looking at the white and you're seeing the bright lights. It's a frightening process, and you're flooding your body with those fight or flight responses. But sure enough, when we have people listen to guided imagery before, they had a significant reduction in pain and anxiety after, so they had to use less narcotics. And in part by improving that pain treatment, they had a decreased length of stay on average by 2 days for the folks who did that. So really can make a huge difference. Biofeedback is another one, which formal biofeedback is a great way to downregulate the sympathetic nervous system or fight or flight and upregulate the parasympathetic nervous system. So the traditional ones will actually, as you can see in this picture on the right side, you're hooked up to things that can look at the tension in your skin, your temperature, your heart rate, your respiratory rate. There's more and more apps coming out with these types of information, but it's really fascinating. I have been trained in this, and I know have been on my pager, and the one that I did was one where you were basically opening up a flower, and you could see as the flower was blooming, you were getting more relaxed and your parasympathetics were more upregulated. So this flower was almost bloomed in completeness, and then my pager went off and it was just poof, right into a bud. So you can just see how what's actually happening to our body in these times that we don't even think about. My pager goes off all the time and I don't think anything about it, but sure enough. But the concept again is really what's happening with your breath and your relaxation overall. Lots of data on this on blood pressure and stress reduction, and ultimately heart rate variability, which you probably are starting to see on your Apple phones. There's more and more about heart rate variability. The more heart rate variability, the better. So the better that your body can get your heart rate up and then bring it back down real quick is a sign of health. I have on here heart math. Heart math is one that I recommend to my patients very frequently. It's about $300. It's not cheap, but it's something that you can do. It's basically biofeedback you can do on your phone and teach yourself. And lots of data behind that on blood pressure control and improved heart rate variability. Tai Chi is another one that's been really great. This was an NIH-sponsored trial. It was looking at folks with congestive heart failure and sort of the more upstream kind of class 2 versus more sick folks. And they had 12 weeks of Tai Chi. And sure enough, these things that we measure, increase quality of life, 6-minute walk test, and a reduction in this blood level called BNP, all improved with the Tai Chi group. So I want to emphasize, for those of you who find this as fascinating as I do, the new TriClip valve just got approved by the FDA. It's a $30,000 valve replacement for the tricuspid valve in your heart. The statistics were the same as this in terms of what it improved. And so we are covering that for our Medicare population at $30,000 a pop. And the only things that it actually showed was an improvement in quality of life and 6-minute walk test. Nothing else in terms of longevity. So we should think about covering Tai Chi. It's a lot cheaper. So, but in lifestyle medicine, I know you're all talking a lot about this, but I would just emphasize how much what we eat impacts our brain and then subsequently our heart, because now we know, right, there's no question about how the brain and the heart are connected in terms of long-term impact, but food really impacts that. And again, I would just mention for myself, after the death of my daughter, it was the single thing for me that made the biggest change each day of those really low days was if I had eaten poorly. So I think that's such a big part for us to understand in how we feel, and then what our brain then produces to our heart and other areas. This is all based on Dean Ornish's work, and I'm sure you guys have seen he's sort of the guru in all of this as it relates to cardiovascular disease and actually improving blockages. So that was a trial he did back in 1990. It was really essentially before we even had statin drugs, and he did show that this actually improved significant blockages in your heart. So what I would emphasize there is it was a walking, it was support. So people could be intimate with one person in their life. It didn't have to be their spouse, but one person that they could trust. And it was vegan, and again, lots of meditation, but it made a big difference. Sleep, I would also just emphasize, is critical for our mental health, to be able to be functioning well, and again, so that we improve that connection to our heart. And you can see on average now we get about 6 hours a night of sleep instead of the recommended 7 to 8. And what sleep deficit then leads to: weight gain, immune compromise, less restoration, and more inflammation. I think that was a big part that we missed during COVID, as we were all talking about immunity and how important it was that we had high functioning immune systems. We didn't talk about the importance of sleep. And once again, all the binging that was going on with Netflix, which again, I'm like a big fan of Netflix, but I just mean that we can't do these things and expect our bodies to be optimally functioning the next day. I also think for folks who have sleep apnea, it's not only a weight-related thing. So sometimes people still have different physiological things and require a CPAP, and that's one of the best things that you can do to decrease mental health and cardiovascular-related complications later. And finally, one thing that I still take out a prescription pad for to prescribe to my patients is the importance of connecting. So we are social beings, and we actually need to see people and be around people and connect. And I think it's, again, sort of gotten lost with a lot of the social media that we have. So remembering that we live longer when we connect. So with that, I would say invest in yourself. You're worth it. This is my favorite place. It's a blue zone in Nosara, Costa Rica. And I just love, the sunsets are truly like that every night. So best thing you can do sometimes is take some time for yourself. So thank you. There's my information. If you have other questions, I think Dr. Kodke is going to speak next, and then we have time for questions afterwards. Is that right? Am I getting? Okay.